Bismillahirrahmanirrahim. Here is Dr. Iman Sheikh, and our topic today is drugs relevant to dentistry. We are using many drugs that we are prescribing in our dental clinic or even for the management of dental pain that the patient came to the clinic because of it. Okay, and those various types of condition need to be treated with some drugs that we must know about it. Very important tips. Okay, so the first and the commonly used drug or medication in the dental clinic is anesthetic agents. In addition to the famous one, which is analgesic or painkiller, antibiotic, antifungal, and antiviral used the treatment of various infectious uh, conditions in the oral cavity. Uh, Also, some drugs related to the periodontal management, such as gingival displacement products and desensitizing agents that used when there is sensitivity related to dentine. Okay. In addition to the very important drug kit that must be available in each dental clinic, okay, which is medical emergency drug kit. So let's start with the anesthetic or local anesthesia. Local anesthesia is given mostly by the operating dentist during various infiltrative techniques and nerve blocks. So we are using dental clinic as a routine. Okay, so we can use this anesthetic agents with every patient came to our clinic. So we can combine this local anesthesia with sedation or topical anesthesia. And as we know before from our first studying in dentistry, there are modern local anesthetic uh, categorized based on their chemical structure. We had amide and ester, and the amide type is the most commonly used. Okay, in the dental clinic, examples lidocaine, prilocaine, mepivacaine, and pipivacaine. Okay, and the additional ester linkage that added to this amide um, give another type or group, and but is not commonly used in dental clinic. It's used as a topical agent which used prior to induction that can reduce the pain or discomfort that came out from the needle. Okay, so dental treatment procedure associated with the mechanical, thermal, chemical stimuli resulting in the pain response. And these procedures include oral surgery, periodontal, endodontic, prosthetic, and restorative treatments. So here we need the local anesthesia indeed. It's used to manage the pain responses during the treatment. Okay, so we are giving the injection before the treatment, and then the patient will feel temporary sensory loss, so the treatment can be proceeded, uh, and the patient will be comfortable. So the procedure will be completed without patient discomfort. Contraindication of the local anesthetic agent is related to the allergic history, which is known and mentioned by the patient. Okay, and the allergy is the only absolute contraindication to the local anesthesia. However, there is some other side effects or complications that's related to the individual's medical status, or uh, you need to make some cautions in some individuals, and toxicity and interactions. So you have to know the drugs that the patient is taking that is not making interaction and making some toxicity to the patient. So the anesthetic agents used in dentistry are lidocaine, of course, lidocaine 2% plain. It's used for block and infiltration. It would produce analgesia for a brief duration. That duration is good enough to complete a simple dental procedure. Okay, maximum safe dose for adults is 4 cartridge, okay, or 3 milligram per kilogram. The lidocaine is effective and can be increased by addition of 1 to 80,000 epinephrine, and maximum adult safe dose is 10 cartridges of 2.2 milliliter cartridge, okay, with epinephrine. Without epinephrine is only 4 cartridges, okay. Another other than lidocaine, we have prilocaine, 3% with philipressine, okay, used for blocks and infiltration. Also, both techniques of anesthesia, and give effective analgesia for longer duration, about 90 minutes. Can you imagine? So if you have multiple procedures or you have a long procedure, you want to just a little concentration of anesthetic agent to be injected to the patient, you can use this type of the local anesthesia. And the maximum auto safe dose is 9 by 2.2 milliliter cartridge, okay, or 6 milligram per kilogram. Articaine, 4% with epinephrine, 1 to 100,000. Currently recommended for infiltration only. Why? Because it has a rapid onset. So the block will not be effective. It will be uh, non-useful in this condition. And the maximum safe dose about 10 or 11, about 7 milligram per kilogram. Bupivacaine, 0.25 or 0.5% plain, is used for block and infiltration. Up to 8 hours of anesthesia is required. So the maximum safe dose is only 2 milligram per kilogram. Let's move to another category of drugs, which is analgesics. When you tell the patient, I will give you a painkiller, this is a very lovely word that you are giving him a magic that will remove, no, will kill the pain. So, what are the analgesics or the painkiller? We have many and numerous analgesics available for pain management. Okay, especially this dental pain, which is painful and annoying pain. And these are categorized into two types, opioid or non-opioids. Okay, the opioid, the famous drug, it's morphine, and the non-opioid are fall from non-steroidal anti-inflammatory drugs such as aspirin, and these are further divided into non-selective and selective. The non-selective, known as TNSAs, and the selective, known as COX, cyclooxygenase inhibitors. Okay, the opioid analgesics are used or prescribed by the dental profession to manage the dental pain. We said that the morphine is the main drug in this category, and the pain suppression is selective in nature without effect on other sensation. That is good. The opioids used in dentistry are hydrocodone, codeine, and oxycodone, and tramadol. So they are used in a severe, prolonged pain that cannot be treated with the non-opioid analgesics or in conjugation with paracetamol and non-opioid analgesics. So it will be effective. The standard dose in dentistry for codeine is 30 to 60 milligram, 5 to 10 milligram for hydrocodone and oxycodone. And clinical studies have repeatedly reported that the non-opioid analgesics are more effective than opioids in reducing the post-operative dental pain. So it will be also more safer than this opioid. Opioid can be addictive to it. You know, the morphine and tramadol, of course. And in dentistry, as we said, the opioid analgesic commonly prescribed in conjugation with acetaminophen, paracetamol, or NSAIDs such as aspirin or diclofenac, sodium, potassium, and so on, to increase the analgesic effect rather than use them alone. So their conjugation together will give effective results. As any drug in the world, these have numerous side effects caused by analgesics, including nausea, vomiting, respiratory depression, constipation, disturbance in the sleep pattern of individuals, and development of dependence and addiction for drug. Okay, especially the opioid. Those opioid can be addicted. So this is important advice to tell your patient not to take these analgesics by themselves. No, they have to be prescribed by the doctor. Okay, so to be safe doses that cannot cause those side effects. Okay, let's move to the non-opioid analgesic, the NSAIDs. We said that there is selective and non-selective. Both of them have anti-inflammatory action, analgesic action, and antipyretic actions. So here I can get more benefit from one drug. So they are commonly used after dental procedure to prevent inflammation and to reduce the pain. Okay, the aspirin is the gold standard to which other analgesics in the among the NSAIDs must compare to it. Okay, aspirin will inhibit COX-1 irreversibly by acetylating it, and return of COX activity depends on production of new enzyme. This the action how the aspirin is working to alleviate the pain and to be an anti-inflammatory agent. Various clinical studies reported that NSAIDs are effective for treatment of moderate to severe dental pain. Let's move to another category, antibiotics. Okay, other than dental pain, there is a very common diseases that make the patient came to our clinic, which is infection. The infection that can cause by bacterial cause is leading to, for example, abscess. Okay, the abscess can cause in the beginning pain and swelling in the area, and those symptoms are annoying to the patients. So these infections of the oral can be managed as soon as possible in a severe that may result in a severe and irrecoverable sequences and a very serious complications. So you have to treat those bacterial infections, for example, to prevent the patient from those serious complications such as osteomyelitis, brain abscess, airway obstruction, carotid infection, sinusitis, septicemia, meningitis, cavernous sinus thrombosis, and orbital abscess, in addition to loss of vision that can be occurred. Uh, Moreover, those dental infections can cause death literally. It has been reported that the most commonly occurring feature in oral facial infections are dental-alveolar abscess, as we said in the beginning. So the antibiotic used by us for the following purposes: for treatment of acute odontogenic infection, also treatment of the non-odontogenic infection, and these drugs are used for prophylaxis against focal infection in the patient at risk of endocarditis and joint prosthesis. So you can give the patient, for example, amoxicillin before the dental procedure that you are going to uh, do. Okay, and also use for prophylaxis against local infection. Okay, and systemic spread in oral surgery. So we can use the antibiotic as a prophylaxis to prevent a serious condition that can occur. Okay. And the infection in the dental origin can be treated by surgical intervention, endodontic treatment, in addition or in conjugation with giving antibiotic therapy. So, many of the dental procedures are followed by prescribing analgesic and antibiotic, even simple extraction for some patients. In dentistry, most commonly used antibiotic are amoxicillin and clindamycin. Amoxicillin used for treatment of the bacterial infections such as abscess, sinusitis, pericoronitis, and acute necrotizing ulcerative gingivitis. And the side effects of the drug, including the common side effects, usually is nausea and vomiting or diarrhea. Severe allergic is rare to occur. And the amoxicillin and penicillin 5 are the safest drugs and the most common drugs can be used during pregnancy. Tetracycline and doxycycline cannot be used or prescribed during pregnancy because they can affect teeth and bone development. Clindamycin can be used as a substitute for the patients that resisting penicillin, okay, the bacteria resisting penicillin in their body, or in a case of the allergy from penicillin. Okay, so the clindamycin is replacement, a good replacement for the penicillin. So please also advise your patient not to take the antibiotic as an analgesic. No, it must be prescribed by the doctor or the dentist for treatment of the real bacterial infection that is existing already. Okay. Um, in addition to the resistant bacteria, using of the broad spectrum antibiotics that can disturb the balance of the microflora in oral cavity result in development of candidal infections, candidosis, for example. So, related to the candidosis, let's move to the antifungal agents. Antifungal agents, of course, used to treat fungal infections, and those fungal infections may produce superficial infestations either to skin or mucous membrane or together, and there may be systemic infections affecting various organs on the body. So we have to take care from the fungal infection to occur. We discussed the fungal infections in the lecture of the candidosis can be caused by local or systemic factors and so on. And the fungal infection is commonly associated with immunodeficiency or patients taking immunosuppressive drugs. And the most common fungal infections caused in the oral cavity is caused by Candida albicans. Systemic infections categorized into two groups of phases of states of the patient and the type of organism causing the infection. As we know that the candidal infection is opportunistic infections occur in weakened and immunocompromised patients. So this can reflect some. If the patient came to you with this fungal infection, you have to search for these factors that causing this infection. Antifungal drug used in dentistry commonly are amphotericin, nystatin, clotrimazole, ketoconazole, meconazole, and they are classified also to antibiotics category or types such as amphotericin and nystatin and hamicin and natamycin. Also, we have number 4, which is azoles, which are commonly used in dentistry as a topical or systemic, and some other agents. Okay, let's move to the antiviral drugs. Antiviral drugs are medication help the body to fight. So they are not curing the viral infection, not like the antifungal and antibacterial. No, it it's only help the body to fight against some viruses that can cause the disease. And these drugs also act as a preventive measure that can protect the human from getting viral infections in the future, or to prevent the spreading of virus uh, from individual to another. And these medications work in different ways depending on the type of the drug, and also depending on the virus that are infected the body. And this drug can cause blockage of receptor, so the virus cannot be bind to receptor and unable to enter into the cells. So we also know that the virus cannot multiply by themselves. They have to invade cells, and using the control of the cell to multiply themselves. So if you block the way for the virus to enter the cell, here you can prevent the multiplication of the virus. In addition to the antiviral, also antiviral drugs can lower the viral load in the body by preventing their multiplications. Also, these drugs can boost the immune system of the body and help body to fight against the viral infections. Okay, the commonest used drugs are acyclovir and valacyclovir. Okay, in addition to famciclovir, are used to against the infections such as herpes simplex infection, varicella zoster, shingles, and chickenpox, in addition to Epstein-Barr virus. Okay, so they can reduce the symptoms and signs associated with the viral infections. Neither acyclovir or cyclovir nor cyclovir cure the viral infection. They only reduce signs and symptoms only. Okay, and these drugs can be taken with or without food, and the best to take the drug around the same time every day to get a best results. For the all patient dose of each drug should be reduced as compared to other patients. And these drugs have impact on viral growth as they inhibit replication of viral DNA. Okay, as we said that according to the drug and the virus, the mechanism of preventing the replication is different from one to another. And other antiviral drugs that can be prescribed are famciclovir and genicyclovir. Side effects are variable depending on the type of the drug and the dose used. Okay, so the adverse effect caused by antiviral are if you are using the topical antiviral agents, it can cause stinging and burning sensation after each application, not only the first time. Each application you are applying this topical agent, it will burn you. Orally taken drugs also can cause a common side effects such as headache, nausea, and malaise, and some CNS effects. Okay, anemia and neutropenia are the most important side effects, and this is related to the patients in immunodeficiency or immunosuppressive condition. A prolonged use as prophylaxis antiviral, okay, to prevent the recurrent lesions related to the viral infections. Nausea, anorexia, abdominal pain, headache, insomnia, and myalgia are somehow common. Myopathy, lactic acidosis, and hepatomegaly, convulsions, and encephalopathy are infrequent side effects. Our last category about the medical emergency drug kits. So, medical emergencies can occur in the dental office. So, we have to put emergency drugs in the dental clinic to use when these conditions occur. Okay, to manage these medical emergencies effectively and safely. In addition to the equipments and medicines, any staff in the dental clinic should know the CPR or cardiopulmonary resuscitation. The first equipment that must be available in the dental clinic is oxygen can. It's a portable and small, about 5 liters, to provide oxygen to patients who are having difficulty in breathing, which can be resulted from various reasons in the dental chair, such as allergy, underlying heart condition, in addition to the oxygen mask to deliver or supply this oxygen to the patient. Blood pressure apparatus, okay, must be digital or manual and useful to monitor the blood pressure to the patient. Stethoscope, either to help in the blood pressure optimizing or in evaluating the heart rate. The glucometer with the strips is also important to check the blood sugar of the patient, as low blood sugar of the patient can result in the coma if it's not attended immediately. Pulse oximeter also is a very important equipment that used to monitor the pulse of the patient in the case of the dental emergency. Artificial manual breathing unit bag also it's important to be available, which is a part of the CPR. It's used instead of mouth to mouth breathing. It's used for helping patient to breathe properly and pump air to the lung forcefully. Okay, let's move to the drugs. The first injection that can be available or must be available is adrenaline or epinephrine. It's used in patients having severe low blood pressure. This is drug which helps in increasing the heart rate to counter low blood pressure. Okay, the perhaps of it is injection atropine. It used to control or decrease the heart rate in a patient with a high blood pressure or in a patient with a hypersalivation to reduce the production of saliva, hence prevents aspiration of saliva in any dental emergency. Okay, other injections are Avil. Avil is used to managing the allergic conditions resulting from dental materials using during the dental treatment procedure. Valium 2 milligram or 5 milligram used to treat anxiety as a short-term treatment option for seizures. Okay. Also, hydrocortisone injection is used to managing allergic reactions, okay, such as Avil, but this for the more serious allergic reactions. Okay. It decreases inflammation also to replace the function of the corticosteroid in the body. We have a tablets of prednisolone. It primarily used as an immunosuppressant or anti-inflammatory medications. Phenytoin injection also is important to treat or prevent seizures, either for the patients who had a history of the seizures or to prevent the condition that can occur in the dental clinic. Okay, we have another important injection, okay, which is Drifilin 2 milliliter, either used for treatment of the asthma attack or treatment of the chronic obstructive pulmonary diseases or COPD. It should be given to the patient who suffers from asthma attack during the dental procedure. Also, in the case of the asthma attack, we can use salbutamol inhaler, Ventolin. We have another tablet which is sorbitrate. It's a nitrate drug that causing the widening of the blood vessels and relaxing the vessels to increase the flow of the blood to the heart. Can be given to the patients with a chest pain, angina, or patient who have history of coronary heart disease. As we said, it will increase the flow of blood to the heart muscles and prevent the heart attack. Another tablet important to be available, which is aspirin. Okay, it's used in a patient who have a history of a heart disease. angina, stroke, heart attack, etc. Also, it's due to its antiplatelet effects. Okay, this drug delay formation of a clot, so it will increase bleeding. Uh, in addition to IV fluid, such as dextrose injection, 100 milliliter. Okay, another important material to be available, which is gel foam dental sponge. In the patient having high blood pressure and on antiplatelet drugs, we have a problem in controlling bleeding from the extraction socket, and the hemo sponge is important to control this bleeding by putting one of them inside the socket. Okay, it helped formation of the blood clot faster. Glucose powder or daily sugar can be used for the patient with a low sugar to increase the blood glucose level. Electrol, such as NaCl, used to replacing salts in the case of the lower blood pressure. And very important thing is to having, in addition to this kit, the drug expiry chart checklist. Okay, so every month you have to check the expiry date for the emergency kit. Okay, especially the injections and the drugs tablets. Okay, and expired drugs can be replaced. Thank you.